Okay, non-selective beta blockers. What is the first thing that you think of? Propranolol. That is a first-line treatment for an essential tremor. So here's a 65-year-old man. His chief complaint is that he's got some shaking of his hands that gets worse when he tries to drink coffee or write. He says the tremor will improve when he has a glass of wine, and his neurological exam is normal except for a tremor during movement. So what's the best first-line therapy? All right, so what is an essential tremor? It's a shaky movement, usually in the hands or the arms, and it gets worse with activity. That's why when he writes, it gets worse, right? It gets better with alcohol, strangely enough, and it's not Parkinson's. An essential tremor is an actual tremor that improves with alcohol, pretty much all you need to know. And so what is propranolol? It's a non-selective beta blocker, so it helps calm the shaking, and it treats essential tremor with any non-selective beta blocker will work, or primidone will also work. It's a barbiturate. And levodopa, that would not be right. That's a Parkinson's treatment, not essential tremor. Primidone is effective, but it's second line if the beta does not work. The beta blocker doesn't work. Diazepam, that's a benzo, and it's not first line, and it has a risk of dependence. So that would be a horrible drug to give. So do not give them this benzo with the risk of dependence, silly goose. All right, here we go. Propranolol is the correct answer. Topiramate, that may help, but it's not first line for sure. So it's going to definitely be propranolol. All right, so essential tremor, that's what we need to fix. And yeah, that's pretty much all there is to it. I guess maybe the mechanism is important. So it is important to know about your alphas and your betas. And what we know about the tremors is that it's related to abnormal activity in the cerebellum and its connections with the brain. And so the cerebellum is the part of the brain that controls the movement of the balance. And so in essential tremor, the signals between the brain and the muscles are a bit too excitable, and that causes the rhythmic shaking. And so it's like you're overreacting. The motor system is overacting. So propranolol is a non-selective beta blocker, and so it'll block the beta-1 receptors, mostly in the heart, and also the beta-2 receptors in muscles and other tissues. And so in a tremor, propranolol will block the beta-2 receptors in the skeletal muscles, for instance, and that reduces the sensitivity of the muscles to the shakiness. So that's why you get less shakiness. And primidone, which you might also think is one of our answer choices, that is a barbiturate-like drug, and it calms down neurons by increasing the GABA activity, because GABA is the brain's calm down chemical. And so it slows an overreacted brain that causes the tremor. So primidone chills the brain, less tremor, excuse me. So yeah, that's all there is to it. Blocking the beta-2 in the muscles to calm them down, or you boost the GABA to calm it down. One or the other, but definitely propranolol is first line. See you in the next one.